Hello, my name is Adela Reyes, and I did a literature review on Are We Built to Last to Live 105 Years Old with Today's Modern Technology and Modern Medicine. We have 100,000 centenarians graying in America. The U.S. Census Bureau estimates the baby boomer population is going to be increasing to over 88 million by 2050. Successful aging and life expectancy can be increased by doing genetic testing with nutrition, physical activity, and cognitive abilities to avoid any problems with dementia or Alzheimer's disease. Genetic testing is now being used to treat people for certain diseases, and DNA editing is one of the techniques that is being used. This CRISP is a coded virus in the DNA strands that are now being removed and replaced with new strands to help patients that have HIV viruses and that now can be treated. Also, researchers in Emory University are using CRISPR to help those people that have Huntington's disease. And this is a brain disorder which causes involuntary twitching and jerking. And also is noted people suffer from depression and changes of personality. So by editing this DNA strands, they can lessen the symptoms of Huntington's disease, and this has been known by studying mice. Nutrition is especially important for the elderly population because most of the elderly do not eat the proper meals that they're supposed to, and it's estimated 3.7 million that are malnourished. So it is important to have a healthy diet to help increase life expectancy, and also this eating healthier foods will also prevent heart disease and diabetes in the elderly. Physical activity in the elderly is extremely important because it keeps them very active mentally and physically, and also helps them with mobility, improves the circulation, strengthens their muscle tone, and also helps strengthen their bones so that they don't break their bones, especially if they have a fall. Today, the elderly have a greater advantage of having a CT scan or an MRI of their chest, their abdomen, or their brain in order to find out if they have any types of tumors or masses that need to be treated. And in the past, there was no technology to help doctors determine what was wrong with the patient. Vaccinations and medications have extended life expectancy in the elderly. It's very important, especially when they have an infection or have terminal cancer. Now they're able to be treated with antibiotics, chemotherapy, radiation therapy, and a lot of times, even though someone has cancer, they're able to recover from it. So they have a greater chance of being treated, where in the past, these options were not available. Modern technology has helped improve surgical interventions because doctors are now able to do all these different types of surgeries, especially for the elderly population. We see a lot of people coming in and out of the operating room and the emergency room due to not being able to eat well. And we have to place a PEG tube or a feeding tube, and a lot of times the elderly are frail, and they do have dementia or Alzheimer's disease, and we have to just be more patient with them. And also we have a lot of people that come in due to having a bowel obstruction, and we have to intervene and remove partial or some of their colon in order for them to survive. In the past, all these different types of surgeries were not made available. And now we can even put a pacemaker if there's any problems with heart arrhythmias, the beating of the heart. In the past, I've also helped the elderly with Baha hearing aids. We've done surgeries where the hearing aid is placed on the temporal bone, and also a cochlear implant is used to transmit waves so that you're able to hear if you happen to lose your hearing due to a virus. It helps the elderly communicate, because without communication, it's very difficult to be able to help someone, especially if they have dementia or Alzheimer's disease that has affected their cognitive ability. Death is no longer considered a natural process, but a failure of modern medicine, because there's so many different types of vaccines and medications. We have x-rays, such as the CT scans and MRI scans, and many different types of surgical interventions to keep people alive, which in the past was difficult to do because there was none of this modern technology to help doctors diagnose and treat different type and forms of chronic diseases or terminal illnesses. The future for the aging population is important, especially if one wants to live to be 105 years old or longer. One has to be an advocate to help the elderly be more active physically and mentally, so that they can increase their lifespan, and also educate families and friends about protecting the elderly instead of stigmatizing them and calling them frail and uncontributing to society. If we communicate more with them, we'll be able to understand their points of views, and we can have a better quality of life for them and help them in the end of care of life decisions as well.